Hi, I'm Brian Hart, and I'm with Smart Living, and I'm really excited to talk about really what smart living is and why it's important. I've been in the field of developmental disabilities for well over a decade now, and I truly love the work that I do. And as I was looking at our field down the next 10 years, and as a lot of agencies were, we were noticing problems in our field. There were more and more people that were being diagnosed or identified with a disability, and more people were outliving their parents and living longer with a disability. And although that is a great problem to have, our system is not set up to really solve all these problems. We're in a position where more and more people need supports, and there's just not enough people to do it. And as we look around our world, it's not unique to disabilities. In every sector across America, each workforce is having a workforce shortage. And so we have to find unique solutions to solve in each area. And technology is one that makes sense. But our field, unfortunately, has not innovated really that well over the last 40 years. We did a really good job of it when we started closing institutions. We saw that people living in institutions was not safe, it was not healthy, and did not really meet any of our core outcomes. And as we moved people to community settings, we started putting staff members in their homes to help them live independently. The problem we have now is when we want to make that next leap into people really being independent and being inclusive members of our society, we have to do it a different way. And that's where technology and smart living comes in. Smart living isn't just a piece of tech. It's not a software program. It's not something you can just buy. It's a new way of delivering services. And this new model takes into account new assessments, new pieces of technology, new ways of training, and really a new culture and way of delivering services, where we start with technology to solve for the problems people have. And then when we can't solve with technology, in-person supports fill the gap with targeted value-add supports. And what that allows us to do is to provide more opportunities for independence and more opportunities for those that don't have supports. Kind of the open secret in our field is that there are tens of thousands of people on massive wait lists across the country. And there's no way we're going to be able to serve more people, let alone the people we have, if we don't do it differently. And that's what's cool about Smart Living is that it really is looking at not just a new project, it's not an initiative, but it's a change that we can make. When I started this project 4 years ago, we didn't know how it would work. We knew that the agency that we demonstrated this with in Cincinnati needed to change because we wanted to serve more people. And so we started using technology. And over the last few years, we found that the people we're supporting have better lives. Our staff have better lives, and the people that we support in our community, the community members, are having better interactions with the people we support. And now I have the great opportunity to work with One Vision and share what we've learned there with you guys. And the work that you guys are doing here at One Vision is already showing huge gains. We are about 4 months into our project as of today, and what we're finding is that in each area, we're finding areas where we can provide better supports. We can provide it for people who really don't need around-the-clock care, but technology can solve a huge gap. And when we talk about why are we doing this, and so when we talk about there's this massive problem with staff shortages, massive problem with funding, that's really not the reason why we're doing this. The reason why we got into this field, the reason why we're doing this work is because we actually care about the work we do. We care about the people we support. And when we think about what are the things that One Vision wants for the people they support, two things come up over and over as I talk to people at the agency. Is they want people to be more independent and they want people to be more inclusive, included in their communities. And that's what this allows us to do. Because what we find is that as we have staff just in the homes, waiting for things to happen, being there just when people are home, the individuals aren't given the opportunity to be as independent as they could. And they're also not in the community as much because we don't have enough people to teach them and train them and take them to the community because everyone's stuck at home waiting for things to go wrong. And so as we make this shift, that's the focus we're looking at. It's going to be great that we won't have as many open positions. It's going to be amazing when people aren't working as much overtime. It's going to be, the greatest thing ever when we can start opening up our wait list and bringing people on. But at the end of the day, what's really going to make a difference is when the people we support are actually more independent and when they're more active members of their community. And what it does is it allows the individuals we support, it forces them to interact more with their community members because there's less staff involved. And it forces the community to interact with our individuals because there's less staff involved. What we've learned through technology-enabled supports also is that it's not one size fits all. And so we have to look at the individual. And that's what allows us to have a catalyst for the largest amount of change. Because we're looking at it at an individual's perspective, we're able to solve for each individual's needs based on technology that already exists and then provide value. And as the staff are providing value in every interaction they have, they like their jobs more, they stay longer, turnover is better, retention is better, and we're able to do more. And you think about in Iowa, all the people that are here in this community that want to support individuals with disabilities, we can use this as a way to give them that opportunity. So really in conclusion, when you get asked the question, why are we using all this tech? What is this change? Why are we doing this? What the heck is smart living? The answer to that question is it's building upon the huge successes that One Vision has made over 50 years in providing the best supports we could possibly provide here to people in Iowa and changing the way we deliver them for the people that it makes sense for to do it better and to do it to more people. And so welcome aboard the journey of smart living. Let's get on this, and we're going to provide it to more people and keep growing.